Hello, this is Dr. Ford Brewer with Prevmed, state-of-the-art heart attack, stroke, and cancer prevention, as well as disability prevention. I think most of our patients are really focused on disability prevention more than anything else. But enough of all of that. I'm going to talk today about Blood Sugar 101. It's a book by Jenny Ruhl, R-U-H-L. I'm a physician. I do heart attack and stroke prevention, and by far I think the number one cause of unpredicted heart attack and stroke prevention is prediabetes or metabolic syndrome that was ignored for often decades. I learned more about that in this book than I have in probably the past maybe 10 hours of continuing medical education on this topic. It's that good. It is a very, very good book. First of all, what is it? She's got a very successful, very comprehensive website, and it's called Blood Sugar 101. And according to the book, you can basically get all the same information by reviewing and scouring the website. I tried that for a few minutes, and it's not that easy. I would clearly recommend getting the book. Now, the book starts off with some really good background information, especially for guys like me who are focused on baby boomers, folks in their 40s, 50s, 60s, and 70s, going into that midlife decline in health, and how to know what's going on, how to prevent that decline in health. She talks about the fact that over 50% of us become insulin resistant by the time we're age 60. She doesn't get too deep into the fact that by the time we're age 65, a quarter of us are full-blown diabetic, although she does make the point that the ADA is doing significant damage to a lot of us, those of us with prediabetes and diabetes, by saying, you know what, you don't really have diabetes until you got a hemoglobin A1C of 7 or more, glucose values of 200. One of the strong points that she makes, parenthetically, later on in the book is that tissue damage appears to start happening around the 140s. She acknowledges, although she does a great job in terms of scouring the research, the medical research that's out there, she acknowledges that there's not a lot of great research underpinning this 140. I would say, though, as a doc doing this, that I think that 140 is a pretty strong number. That's certainly when we ramp up the emotion and concern and warning for our patients who do have insulin resistance. And obviously the way to look at that is not with just hemoglobin A1C, it's with oral glucose tolerance testing. Now, let's go back and talk about a little bit more focus around the book and what makes it good, what makes it, where are the problems. She does a great job in terms of calling out groups like the ADA in terms of saying, you should have 100 grams or more in your diabetic diet. No, you shouldn't, and diabetics have proven that over and over and over again. All that does is result in more burning up of diabetics' arteries and tissue. She doesn't get into a lot of details regarding why the ADA's made recommendations like that. Again, other problems associated, as I've already mentioned, with why the ADA's made such conservative diagnostic criteria. Researchers, the guys that did the UKYPDS, the United Kingdom progression of diabetes study, that was really a travesty, and it has resulted in a lot of probable, again, lost human potential and life and human body tissue. they mistakenly said tight control of diabetes is a hemoglobin, a A1C of 7, or um, blood glucose levels in the 170s, and said we achieved that with a lot of folks, but that still didn't improve their the preservation of their body tissues. That's not good diabetic control. And so, again, did the opposite of creating a false sense of hope among diabetics, created a false sense of despair. You can decrease and prevent damage to diabetic tissue. Richard Bernstein, Jenny Ruhl, and others are correct. She's in a group called the 5% Club. Keeping your, even if you're diabetic, keeping your hemoglobin A1C below 5% can and does decrease diabetic damage to your tissues. So, again, shame on a lot of the medical researchers out there, like the UK-wide PDS folks, and my kudos to Jenny Ruhl, Richard Bernstein, and some of those others that say, look, even if you're diabetic, keep your blood sugar 100 or below, and you're good. Again, Richard Bernstein would say keep it in your 80s, and once he hit his 80s, he had an HDL over 100. So the lower you keep that blood sugar, at least down to 80s or so, the better off you are, and the more tissue preservation you have, and the less you age. There was an interesting, well, let me go back and talk for a minute about what I think her major contribution is. I think her major contribution has to do with diets, specifically low-carb diets for those of us with diabetes or prediabetes, metabolic syndrome. Low-carb diets have been a huge rage for a long time, and you hear the same thing from her that you hear from some of the others. You know, with Gary Taubes, Richard Bernstein, and her, all basically talking about the insulin theory. And here's the way the insulin theory goes. Dietary carbs in your diet stimulate insulin. Insulin totally changes our metabolism, stopping any glucose burn, stopping any fat burn, and creating fat deposition. After all that fat deposition, we get hungry. So, in other words, and again, you get it over and over and over and over and over again in Gary Taubes' books. We get fat, and that causes us to eat too much. In other words, they turn the current wisdom on its head. The current wisdom is we get fat because we eat too much. Their perspective is no, we eat carbs. Carbs cause us to get fat, and getting fat causes us to eat too much. Parenthetically, I like her book around this issue much more than Taubes's. Taubes's, at a certain point, it started off very entertaining, but at a certain point became more like a theory masquerading as reporting. Bernstein and Ruhl both seem to report much more from their experience. Ruhl's from the experience of the thousands of people that contribute to her website, and Bernstein's from the patients that he's seen as a nationally recognized diabetes doc. A couple of other things. The fact that Jenny Ruhl is not a medically trained professional cuts both ways. On the one hand, she makes it pretty clear her disappointment with the medical authorities as they weigh in on diabetes. On the other hand, she misses the mark, I think, on a couple of things. As a physician, let me give you an example. So she sees metformin and insulin. Metformin is great. Insulin is, well, it's got to be tolerated. Everything else is pure poison. I don't think she's entirely off the mark with that. However, I've got tons of patients that can't tolerate metformin. So there are, you do have to look at other options. And although she calls pioglitazone a poison, and every regulated drug is a poison, every prescription drug is in some way or another, including metformin, you still have to weigh your benefits, your risks, and like Pogo says, you pay your money, you take your licks. She also sees all of the gliptins, again, as poisons. And, given some of the cardiovascular stuff, some of the pancreatitis and cancer-related things, I think that the post-marketing information is showing there are challenges with the newer medications, DPP-4 inhibitors, the SGL2 inhibitors as well. Bottom line, I'm a major fan of Jenny Ruhl. I think she's done a great job with this book. I've recommended it to many of my patients with prediabetes. And there's so much in this book. I may have to come back and add some more information later. I will, by the way, do a review on her other book, Diet 101.